Hello, Happy New Year, and welcome to the winter edition of On the Road with David Stordo. And I'm here today at the Spaulding Brighton Nursing and Therapy Facility that just opened at the end of October with Dr. Mark Yurkofsky and Maureen Calnan. Dr. Yurkofsky, Maureen, tell me about the new facility.
Oh, it's just absolutely wonderful. It's wonderful to be in a facility that's been completely renovated, to bring our two families together, our North End family and our West Roxbury family. We've learned what works and what doesn't work. We've just really become one big family very quickly.
And not only did you bring new people together in a new facility, but you went live on eCare at the same time?
You know, I think we had a few tough nights of sleep going into it. And I think we've had terrific support from the eCare team and other clinicians who've been through the process, and that made it a whole lot easier. I think it is interesting that as far as I know, we are the only freestanding skilled nursing facility in the country using Epic as its operating system. And I've already had some calls from a physician in Connecticut asking us how we did it.
As director of nursing, how did the nurses adapt to the new system?
The nurses are absolutely shining. This was quite a challenge. You know, some of our staff, nurses' aides especially, have not had a lot of experience with computers. So for them, this was a whole new world. And they're, again, you know, I see the camaraderie, they're helping each other.
So how is this facility different than other skilled nursing facilities?
Well, I've been working in skilled nursing facilities since the mid-1990s, and this building in our program is really unique. We have teams of physicians and nurse practitioners on site 7 days a week. We have clinicians who have a variety of expertise and experience, and we are very good at sharing best practices with each other and learning from each other.
From a nursing point of view, we have tremendous support throughout the network, and being part of the Spaulding network, I think, differentiates us from other nursing facilities as well.
Where are the patients coming from?
You know, we have some of the more challenging patients from our Brigham and Mass General hospitals, as well as some of our community hospitals. And what's really important in managing these complex patients is the integration of our care with other caregivers outside of our building, whether it's primary care physicians or specialists. And certainly being on Epic makes that job a whole lot easier.
So you're able to relate to one another back between the facility and the MGH of the Brigham?
Yes, we really create virtual teams electronically that can provide support to each other as we take care of these patients.
So now the Spaulding Network has two sites in Brighton, our outpatient center that's been around for quite a while, and now our nursing and therapy facility that we just opened at the end of October. And so now we're going to talk about how we meet the skilled nursing needs of people who don't come to the facility in Brighton.
So we're going to learn how to use a reacher because this is something.
And now I'm here with Nancy Schmidt, Penny Maylor, and Joe Deveau. Nancy, tell me what happens with our patients who need skilled nursing facilities who can't come to our facility here in Brighton.
Sure. So as you know, Partners discharges 13,000 patients into skilled facilities every year. 13,000. And as much as we would love for those patients to come here, that's not possible. So we needed to create a network of high-performing skilled facilities. And we did that 4 years ago. We're actually in the 5th year of the Partners Skilled Facility Network.
So Penny, tell me, how does the collaborative work?
There's an application process that facilities have to go through. Well, the initial process is based on their quality scores through their CMS star ratings and also their DPH scores. And then we get into more details about organizational structures, patient outcomes, patient satisfaction surveys, and their willingness to work with us to share best practices for patients.
Do we have a geographic spread of the facilities to accommodate where people live?
We sure do. We have 69 facilities in the collaborative, so we cover a wide area.
And Joe, you run one of the facilities that's part of the collaborative. Tell us about your facility.
Maristhill is a 104-bed skilled facility in Waltham. We're a 5-star rated building, and we've been part of the collaborative for over a year.
Tell me, what is it like to be part of the collaborative?
Being part of the collaborative allows you to share resources and information and education, and it's phenomenal to be part of a bigger picture.
So I hope you enjoyed learning about our skilled nursing facility in Brighton and also learning about our skilled nursing facility collaborative. So I'll see you again in the spring for the next episode of On the Road with David Stordo.